Malaria is transferred by mosquitoes to humans. Once in the bloodstream, the parasite takes refuge in the liver, where it lays eggs. Eggs hatch a week later, and 10 to 40,000 active parasites spread through the body, each of them looking for a single red blood cell to carve its way into, lay eggs, and do this again. So the result is you have less red blood cells that can actively transfer oxygen. You then have less oxygen, you have less activity, you have more fatigue, and you have parasites invading virtually every part of your body, including your brain. The results are devastating and possibly fatal. Malaria is the most important parasitic disease in the world, according to the Centers for Disease Control. In fact, 1 million children a year will die from malaria. Most of them, about 80%, will be from Africa, just because it's a warm, moist climate. This is important because 2 children every minute will die. That means in the time it took me to say this to you, 2 children have already died. This means 3,000 children a day will die. The important thing there is that children are dying. And according to epidemiology and Centers for Disease reports, 2/3 of these can be prevented. That means most children under 5 years of age are dying in Africa. Not some, more than half of the children under 5 years of age are dying from malaria, and 2/3 of those can be prevented. The average child in Africa is stung by a mosquito 60 to 300 times a year, putting them at high risk of getting malaria. What that means is 1 week after you're stung by a mosquito, you start to have symptoms. The symptoms appear to be flu-like, so at first you just say, you know what, I'm going to wait a night to see if this is just the flu and if it's going to go away or not. But by morning, they have a high fever, they're very lethargic, they have chronic fatigue, they may even start to vomit or throw up, and at this point you say, you know what, I've got to get my child to a doctor. Okay, but you're in sub-Saharan Africa. First of all, you probably don't own a car, so you've got to arrange for transportation. Then you've got to travel across dirt roads through tribal lands. You finally come to a city that has a doctor. You're going to go without insurance into a line that's very long, probably 4 hours long, just to be seen. By now your child is in convulsions, your child is dehydrated, your child is at a point where if they don't get help within an hour or 2, they're probably going to slide into a coma. You're frantic by now and you're pushing to the front of the line. You finally get a doctor and you finally get help, and hopefully you got the right medicine. Hopefully it wasn't just a sugar pill. Now you have a problem. You have a problem, and this is it. You've got 110 people per doctor per day that are being seen for malaria, and you may not have any lab work, you may not have any medication, you may not even get the doctor, you may only get a nurse or somebody who's partially trained. But if you do, you still have the problem that drugs don't solve malaria. I'd like to present you a problem that is being solved with Silver Sol. Silver Sol destroys the parasite that causes malaria. There's 58 clinical trials. In these, we found 100% success in every single patient. What this means is, in 5 days, you can have solution to your malaria problem. And you can also use it for prevention. Silver Sol is a specialized product that's been patented, that's been approved as a drug in Africa, that's actually got a patent claim for malaria. And by the way, I myself went over to Africa and I have seen with my own eyes the effects that this silver solution has. And it's dramatic. 900 out of 900 people tested actually got well, and the average time back to work or back to normal function was less than 5 days each. And by the way, the cost was remarkably less than the drugs. 3 clinics were chosen in Africa. They all had doctors that were trained in United States medical schools. went back to Africa where they have a practice. These people are angels. They treat people for the government in the hospitals half of the day. The other half of the day, they work for free. For anyone who will come into their clinic, they usually just give of their services because people don't have money to pay. Most of these people don't have four walls to live in, let alone health insurance or an option of their own doctor. So these doctors are living a life, 50% of their time, they're giving it away and donating it. Let me tell you what we found in these hospitals. With the lab results, with the medical doctors, we found in 3 clinics 100% success with SilverSol against malaria. In fact, it was so successful that we brought the results back to America and they were presented before a subcommittee of Congress, wherein Congress made it a part of the medical record of the National Institutes of Health. This is a record that is published. You can have it, you can see it, but more importantly, you can help people in Africa with all these problems, meaning malaria was treated. But in the process, because this product destroys bacteria, viruses, and fungus, it helped with respiratory tract infections, urinary tract infections. It even destroys syphilis and gonorrhea, or sexually transmitted diseases. So imagine a 5-year-old child coming in to be treated for malaria, but in the process, their ear infection is treated with the same substance. Their urinary tract infection is cleaned up in the same amount of time. Respiratory tract infections were cleaned up at the same time. And the doctors are literally begging for more of this substance because it treats more than just malaria. It treats the whole family and helps prevent the problems that have been occurring, not only malaria, but others. This is important because if we can get the children well, we can help keep the families well. If we can keep the families well, they can keep employment. If they can be employed, they can get themselves out of the economic problems that they have. I went to Africa. I took as much silver as I could possibly take on the airplane, and I went to the doctors, and they treated these patients. Children were the first. We took children 5 years and younger, and most of our problems came in that group because their immune systems aren't developed yet, not as well as an adult, and so they're very susceptible to the malaria problem. So we took children that were 2, children that were 1. We gave them SilverSol. It's this simple. They needed to swallow 1 ounce a day of the liquid. They usually took 3 doses of 1/3 ounce each. These children responded, and we found that in their medical records, in 2 days, they had about half the parasite in them that they did from the start. And in 4 days, all the parasite was removed from their bloodstream, and they were back to normal function. We also took teenagers. Teenagers responded exactly the same, with this one exception. Some of the teenagers have had malaria so many times, meaning 3 or 4 times a year, that their malaria is kind of resistant. In other words, it's stronger in them and it's more difficult to get over. These teenagers still, all of them, had a solution, but it lasted about 1.5 days longer till they were back to normal function. Adults that took this, all of them got well, and every one of them was back to work in less than 5 days. So these patients are people. Let me tell you about one. I don't even know his name. It's an African name. But I remember seeing him 1 hour from death, covered head to toe in boils. He had a fever that was 105, comatose, sometimes in, sometimes out of consciousness, urinary tract infection, respiratory tract infection, ear infection, eyes bulging. This child was 1 hour from death because of dehydration and all the other problems. When we took the silver and poured it into his mouth, he threw it back up. We had to give it to him 1 or 2 drops at a time. After about 5 minutes, we were able to get 1 ounce of fluid into him. 4 days later, he was walking, he was talking, he was conversing, he was playing, he was well. So was his respiratory tract infection, so was his ear infection. His mother was delighted. In fact, she came to me and she pulled on my arm, and translators helped me understand what she said. She thanked God for the help we delivered. It's not me. This product was formulated in its all-natural form by God. Its only two ingredients are pure 100% metallic silver and pure water. Those are the only two ingredients, and these are the benefits we're getting. I suggest God is its formulator. The most all-natural product I can imagine is doing all of these things. This is important. This is important to this woman, but here's the rest of the story. 2 weeks later, I'm already home. I'm back in the United States. She gives a call. She says, my 6-year-old child, a daughter, is now infected with malaria. Please, you've got to send some more of that silver. Well, we sent it. We took it all. We gave 900 doses to 900 people, and it was totally and completely successful 100% of the time. And her son was the most close to death, but he survived. At this point, we did all we could to send the silver, but it took 3 weeks to get there. In those 3 weeks, the translators informed us that her 6-year-old daughter died. And we received a letter back in translation form asking why we could come to their country and their household, save a son and not a daughter. They need help. This is happening every day. And it breaks my heart to have to be the one to say, I gave you all that I have, and it's not enough. Because 3 weeks that it took to ship the product there, in that time period, her daughter died. And you know what? Every single minute, 2 more children die. We have a solution. We have a help. Let's get it to these people who need it most.